Welcome to Aldevron Tower.
It is my pleasure to be here in this beautiful new building on NDSU's campus. Aldevron Tower is the $28 million home to the College of Health Professions, and it is funded entirely by NDSU alumni and friends. Philanthropy is vital in facility projects like this. The benefactors who supported Aldevron Tower know that in order to go out into the world prepared, NDSU students must learn, work, and perform in 21st century environments. Their gifts helped enhance the way education happens so that every NDSU student, faculty member, and staff member can thrive. During this program, we'll take you through the building so you'll see what makes Aldevron Tower unique and why it is essential in educating of the next generation of healthcare professionals for our state and region. You'll hear from NDSU President Dean Bresciani, Dean of the College of Health Professions, Charles Peterson, representatives from Sanford Health, Gate City Bank, and two of the co-founders of Aldevron and NDSU alumni, Michael Chambers and John Valentine. An NDSU faculty member and students will share how this incredible state-of-the-art facility elevates the educational experience. Let's get started.
Hi there. You're probably wondering why I'm filming from one of the hospitals here in Fargo. Well, the fact is I'm not. I'm in the Nursing Skills Lab on the second floor of Aldevron Tower. And if you think it looks exactly like a hospital, that's exactly what we want it to look like. This gives our nursing students the opportunities to practice their skills and prepare in a real-world, real-life, high-tech hospital environment. High-end mannequins, the exact equipment they'll be using, every detail has been thought through so that their practical experience prepares them for working with real patients after they graduate. We even go so far as to hire actors to come in as test patients so that they get the experience of bringing in a new patient and assessing them as if it was the work setting. It was a lot of fun one time when I was a surprise nursing patient. You can imagine the students' reactions when they walked in and said, "What's wrong with Dr. Bresciani?" But it was a very effective learning opportunity for them because they're going to face those sorts of people out in the environment that are going to be working in after graduation. We put them through those paces to make that as real as possible. Everything from initial patient assessment, intubation, IVs, catheters, bed transfers, patient transfers out of the ward. Everything is simulated to be exactly like the working environment they're going to face when they graduate.
I'm so excited to be here at the Simulation Center in Aldevron Tower, not only for the great technology that's here, but really for what the building represents, which is transformative healthcare and a new age for medicine and how that's delivered. And that's always been the inspiration behind Aldevron and our relationship with NDSU. Aldevron is a Fargo-based biotechnology company focused on gene therapy research, a field that is transforming the entire healthcare sector. We provide nucleic acids that are used to regulate, replace, and repair defective genes to treat and prevent disease. All of this started with a research project at North Dakota State University. And to this day, NDSU remains one of our most important partners. The co-founders of Aldevron all went to school together here. The foundational work for the company, the foundational research was done a few hundred feet away in Sudrow Hall. John Valentine, our chief scientific officer, Victoria, my wife, was a co-founder of the company, helped us build our commercial infrastructure. My brother Matt built our brand. He designed the iconic spark that you see at top of Aldevron Tower. All went to NDSU. Our professors provided a research experience that allowed us to develop the technology that today is helping millions of people around the world. One of the best things about NDSU is the research experience it provides undergraduates. I was able to work in a laboratory in my freshman year. In my sophomore year, I was actually awarded a grant to study a new field called DNA vaccines. And one of the first things you learn when you work with DNA vaccines is that you need a lot of plasma DNA. And so my colleagues and I worked together to develop ways that have never been done before to manufacture very large quantities of a special type of DNA called plasma DNA. This formed the basis for Aldevron. Today, we employ hundreds of NDSU graduates, and we depend on the institution to help us build a company and to serve the world by providing advanced gene therapy options. The Simulation Center will help to improve patient care by training current and future healthcare professionals. These students will be able to hone their skills and develop advanced techniques while practicing on the center's models. The simulation suite includes a pediatric patient room, a trauma bay and birthing suite, medical and surgical patient rooms, a home health simulation lab, a nurse's station, record and playback options to help students learn, and many other state-of-the-art features.
We've waited a long time for this day to arrive. It's been 14 years in the making, but now the building is finally completed, and it's already having a tremendous impact on our students, faculty, staff, and healthcare workforce. It all started with a big dream, and not everybody believed it was possible. But thankfully, many of you, our alumni and corporate friends, did believe and thought it was possible. And you not only stepped up to generously give, but you also turned it into a history-making event, creating the very first all privately funded academic building on campus, which now towers above all the rest. This new state-of-the-art facility will provide us much-needed additional space to address our tremendous growth that we've had as a college. It'll also supply our faculty with the latest advances in technology to provide the highest quality education to our students. It'll also allow us to train our students as a member of a healthcare team to ensure that they're team ready as well as practice ready, and allow us to supply a critical healthcare workforce for the state and region. We'll also be able to expand our research capacity, being able to provide cutting-edge research in critical areas such as cancer, Alzheimer's, diabetes, and obesity. So we designed Aldevron Tower with flexible learning spaces that are open, accessible, and shared spaces that can be used by all of our healthcare disciplines. So rather than having separate conference rooms, classrooms, skills labs for each of the disciplines, they shared the space and can use it either for their discipline-specific training, or they can work together to promote interprofessional education, caring for patients as a healthcare team. Sharing space makes it much more efficient and cost-effective in use of the space, and it encourages collaborative learning and teamwork. The room that I'm in, Aldevron 150, Dave and Joy Amundsen's Ivan Seminar Room, is a classic example of the state-of-the-art technology that is used to provide distance education to literally anywhere in the world. Our public health program, for example, delivers education to students simultaneously on campus in 12 different states, 8 tribal nations, and in 5 different countries. We also use this space to share faculty expertise between the disciplines and in many locations, including our nursing program, for example, which we have 2 locations, Fargo and Bismarck. We're able to share faculty that makes delivery much more efficient and cost-effective, but they can also be used for student organization meetings and for things like Hope Camp for high school seniors exploring healthcare careers. And they also have been used to provide executive board meetings for our corporate partners. So that high degree of flexibility really allows us to be creative, have fun with the facility, and allow us to be optimally efficient and effective.
When Aldevron was asked to participate in the building of this fantastic facility, we were extremely happy to get involved. We understand, because of the footprint that we occupy and our part of the continuum of the biotech universe, we see a lot of new sort of nascent technologies that come along, and they need facilities and people like this to be able to bring those to fruition. As many of you know, Aldevron was founded on the campus of North Dakota State University by myself and Michael Chambers in 1998. I was working on my PhD in the Department of Pharmaceutical Sciences, which is just over there. And Mike was finishing up his undergraduate degree in biotechnology and microbiology. It wasn't just the quality of the education that emboldened us to go out and try doing this. It was also the fact that we were young and naive. But one of the things that really stood out was the ability to work across departments. Perhaps it was the time, perhaps it was the demography, the geography of the area, was the willingness of faculty to work with you, even though they might have thought, these guys, they're crazy. But we had an instance where there was a sort of an overlap in that one of my colleagues was working with liposomes for the delivery of cancer agents, and Mike was working with DNA and needed a better way to formulate it to get better delivery. The delivery of nucleic acids now is a huge business, and there's an enormous center of expertise right down here in the Department of Pharmaceutical Sciences as it relates to the delivery of nucleic acids. But at the time, it was something novel, it was something new, and it was actually going to initially be the crux of what the company was founded on in many ways. We went down a different path eventually, but it was the right place, the right time. It was a challenging time for biotechnology for other reasons, but it was also what would probably now stand on a milestone as being the sort of rebirth of the industry. As we start to understand more about metabolism and things like epigenetics, it becomes possible to tailor dosing regimens more accurately to the individual. This building, this tower, is an extremely good set of cross-functional capabilities that are going to augment that in terms of training and teaching. This room I'm standing in right now is a fine example of that. This is a sterile room. It's designed to be utilized for training in compounding, typically of small drug molecules, into aqueous solutions for injection. But it can be a lot more than that, and I'd like to explain. There is a confluence of technologies that have come together now over the last few years, the first and foremost of them being early cancer detection methods. And by early, I mean months to years, which is a complete game changer. The second of them, I would say, is now the ability to use semi-synthetic techniques to manufacture very complex biologicals. And the third, of course, is the bioinformatics systems that exist out there in the world right now. There is probably no better example of tailoring a regimen for treatment than what exists in a small segment of the neoantigen space, and that is individualized cancer treatments. The training that can occur in these spaces is going to be absolutely vital to the advancement of that segment of the industry. So one way of looking at it is now, because of things like semi-synthetic biology, you are able to make very, very small footprint operations that used to take up a lot of space. The ability to work and maintain a chain of custody, to maintain and operate aseptically, and to do everything from the bioinformatic design, the synthesis, the manufacturing event, the harvesting of cells, the transduction of those cells, the expansion and reintroduction into the patient. In order for this technology to reach its maximum capability, there is an absolutely critical need for people trained in that type of operation who can get it right first time and have undertaken the rigor of training in a place like this. And so I think this is a fine example of the type of an asset that lies within this building on this great campus adjacent to the Department of Pharmaceutical Sciences as a way of massively expanding the footprint of the workforce that's going to be needed in the future to take and run with the work and stand on the shoulders of those giants that have helped to create this sort of capability, these types of sciences.
Aldevron Tower showcases the educational experience we get in the College of Health Professions here at NDSU. Interprofessional collaboration is critical in today's healthcare industry. Working with and learning from my peers in the college while in Aldevron Tower will be essential for my future career and patient interactions as a pharmacist. There's so much more study space. The lab space has greatly improved and the technology, and I know that students are so excited to finally be able to use these labs and get the experience they need to help their patients. The concept pharmacy here in Aldevron Tower is huge. First of all, the space is phenomenal. Going in there the first time, I was so excited to see that there's so much more counter space, so many more computers that we can utilize. I also learned that there's going to be more opportunities to work with telehealth, which is something I think is very important, especially in today's times. We have more area for consultation, which is very important for patient care. It's something that you can't really learn in a classroom, you have to learn in a lab. And so that's something I'm very grateful for and excited to use. Another area that's very new and improved would be the sterile compounding area. There's new sinks, there's so many more hoods. We don't have to wait as long to get in there and get the experience that we need. And it's all about hands-on. That's the most important thing that you're going to get here in this new lab is just so much more opportunities for hands-on care. And that's what will be better beneficial to the patients. So as a pharmacy student, I am very eager to get in and use my new lab, but I also know that my fellow peers in the nursing program are excited to use their new lab space. All of us health profession students need the hands-on experience now in order to provide the proper patient care in the future. And this new facility and all the new space is going to allow them and me to work together to help a patient. When prospective students come here and see these amazing spaces, they will want to come here and learn.
We are so excited to celebrate Aldevron Tower with you today. Gate City Bank is community focused, and we always look for opportunities to provide creative financial solutions to projects that support our communities. Our commitment to NDSU is long-standing, and we had the unique opportunity to provide low-interest financing for this project, which resulted in an in-kind donation of $2.5 million to this state-of-the-art facility. At Gate City Bank, we are passionate about supporting our communities to provide for a better way of life. Together, with NDSU, we're creating strong, vibrant communities. Promoting the health of our communities is paramount. Aldevron Tower allows NDSU to expand its education and research to meet the region's growing need for healthcare professionals. Gate City Bank is proud to partner with NDSU to advance healthcare and provide greater opportunities for young professionals in our communities.
I'm here in the North Dakota Pharmacists Association Instructional Laboratory, where students are taught the knowledge, skills, and abilities needed to be successful in community and institutional pharmacy practice, with an emphasis on patient education, compounding, and telepharmacy. The Instructional Laboratory is a licensed pharmacy. We're preparing students for authentic, real-world experience. The Instructional Laboratory has a model clean room suite. Students learn hands-on how to prepare simulated non-hazardous and hazardous compounding sterile preparations using aseptic technique and in compliance with USP 797. The Instructional Pharmacy has a non-sterile compounding area which also functions as a space to practice point-of-care testing and disease state management. Our model community pharmacy provides students with opportunities to practice dispensing, patient consultation, and medication therapy management. The combination of faculty expertise in the College of Health Professions, along with the latest technology and an exceptional physical space, means that our students will have the educational foundation needed to be successful upon graduation. While we appreciated our previous space, the areas where students learn and study in Aldevron Tower add so much to our ability to prepare them for their future careers. Thank you to those who have helped make the Aldevron Tower possible. As a faculty member in the School of Pharmacy, your investment in our students and in this building helps us teach in new ways. The Instructional Laboratory more than doubles the teaching space we had in the previous laboratory. My teaching colleagues in nursing, public health, and allied sciences have also noted how positively the updated facilities have impacted our students' learning.
It is an honor for me to be here with you today to celebrate the opening of Aldevron Tower. It is through the partnership that we have had with NDSU for decades that I stand before you today to really honor this unveiling of Aldevron Tower. The partnership and the commonalities that we share surround our community and the care that we provide to our community. We are both invested in making sure that our community has what they need in times of care for patients. As we've seen through the pandemic, we know now more than ever the importance of our healthcare workers. We know that they are there for us to pave the way when new things come up, and they are there to really stand by that patient and take the care that they need. And we want to make sure that we're partnering with NDSU and continuing that partnership for years to come to be able to make sure that we have that care in our community. As we look at the clinical experience of the students that come into our organization, we know that we have physicians, nurses, and other support services that rally around them to help them learn and to mentor them in their training. This is not about making sure that nurses pick Sanford, but really about making sure that we have nurses to care for patients in our community and care for the needs of those that are there for our community. We want to make sure that we are providing good care, being safe, making sure that if you, myself, or any friends or family are in need, that we are there to take care of those needs, as well as making sure that we have that career advancement and academic partnership to be able to grow individuals to advance themselves in healthcare.
Thank you from the bottom of all of the hearts of the students here at NDSU.
Thank you to all the benefactors who helped make Aldevron Tower a reality.
Thank you.
Thank you.
On behalf of faculty in the College of Health Professions, thank you.
Thank you.
Thank you.
I'd like to thank the benefactors from the other entities that chipped in to build this fantastic building.
I can't say it often enough, I can't say it loud enough. But thank you for your support in making this possible.
Wow. Every time I go through this space, I'm reminded of the dedication of so many to make this vision a reality. Thank you to those who manage the logistics of this project from beginning to end. Brian Boyle, Brent DeCray, Mike Ellingson, Chris Hamry, Corey Hansen, Ron Kohler, Kyle Kraft, and Keith Sorensen from NDSU Facilities. And a special thank you to Lori Peterson from the College of Health Professions. Thank you to all the benefactors who believed in a vision of how we could better educate the next generation of health professionals. Your investment in this space truly changes the landscape of education at North Dakota State University. The research, teaching, and learning happening in Aldevron Tower will, no doubt, spark future innovations that will forever impact the state, region, and beyond. Now, the others will join me. We'll cut the ribbon and officially dedicate Aldevron Tower. 3, 2, 1.